Welcome to Lecture 19, where we will go over the reproductive system. Menopause typically occurs once the ovaries become desensitized to FSH and LH. This then leads to an overall decline in the production of estradiol that typically occurs around the ages of 46 to 54. Menopause can actually be considered an evolutionary advantage for a female. This is because as a female undergoes menopause, they can then direct more energy to the care of their children as well as grandchildren. By ending the reproductive phase of life and directing energy to the care of offspring and grandchildren, this may actually increase the woman's fitness and her ability to pass on genes through her offspring, given the genetic relationship between parents, their offspring, and grandchildren. We're now going to take a look at the different phases of sexual arousal and embryonic development. There are two main physiological reactions that occur in males and females. These can be referred to as vasocongestion, the filling of tissue with blood, and myotonia, the increase in muscle tension. The sexual response has four interrelated stages. Sexual response begins with excitement, which is the phase that typically prepares the genitalia for sexual intercourse. This is then followed by a plateau where sexual responses continues. In females, the outer and inner walls of the vagina will expand, and the uterus will elevate to create a depression at the back of the vagina for sperm delivery. Heart rate and respiration rate will also increase. This is then followed by orgasm, which consists of rhythmic contractions of the reproductive structures. In males, the semen is delivered to the urethra and then ejected as the urethra contracts during ejaculation. In females, the uterus and outer structures contract. The last stage of sexual response is termed resolution. This occurs when the vasocongestion dissipates and the muscles relax. Males have a refractory period where they can not hold an erection for minutes to hours, whereas females typically do not have a resolution period, a refractory period. Conception occurs at the moment that sperm and the egg fuse. After ejaculation, coagulants are present to keep sperm in place until the cervix is reached. However, once the sperm reaches the cervix, anticoagulants become activated to liquefy the semen. This allows the sperm to disperse and swim through the cervix to enter into the oviducts. As the sperm enters the egg, meiosis is completed, and this will then lead to the production of a mature oocyte. This will also occur as the nuclei fuse to form a zygote. Cleavage then occurs as the zygote moves down the fallopian tubes. The zygote is directed due to the ciliary movement of the epithelium lining the fallopian tubes. The embryo will then form a blastocyst. This blastocyst will then implant into the uterine wall approximately 7 days post-conception. The structure of the blastocyst consists of an outer layer of trophoblast cells, as well as an inner cell mass, which eventually will form the embryo. These trophoblast cells are important as they will extend out to integrate with the endometrium. This will eventually help to form the placenta. Note that if the embryo splits into two independent mitotically dividing structures in early development, this may lead to the formation of monozygotic twins. Fraternal twins, however, result from the release and fertilization of more than one egg in a cycle. This diagram here depicts the process of conception as well as implantation. Note that ovulation releases the secondary oocyte, which will enter into the oviduct. Fertilization will occur in the oviduct. The oocyte will then complete meiosis and then be directed towards the uterus. Cleavage and cell division will begin in the oviduct as the embryo is traveling down the fallopian tube. Cleavage will continue to eventually form the blastocyst. The blastocyst will then eventually implant in the endometrial lining. This occurs approximately 7 days after conception. The lower part of this diagram depicts the implantation process. Note the extension of the trophoblast cells that integrates into the endometrial lining, which then causes the blastocyst to invade the endometrial tissue. During the first trimester, which occurs from 0 to 13 weeks, the implanted embryo will secrete human chorionic growth hormone, or HCG. This will help to maintain the uterine lining to help nourish the developing blastocyst. This is also the hormone that is commonly detected in pregnancy tests. The placenta will form between blood vessels of the embryo and the mother. These blood vessels will connect through the chorionic villus that contains the fetal capillaries. The umbilical arteries and veins will eventually bring blood from and to the embryo. The placenta will help supply the embryo with gases, nutrients, immunity, and will also allow for waste exchange. The placenta also will aid in suppressing the maternal immune response to protect the developing embryo. High progesterone levels will help prevent ovulation and subsequent fertilization of any other oocytes. Progesterone will also help to enlarge the breast and uterus and cause the cervical mucus plug to form to prevent infection. The high progesterone levels is also attributed to morning sickness or may cause episodes of nausea in the mother. During the first trimester, organogenesis occurs. Most of the adult structures are present in rudimentary form by 8 weeks. At this time, the embryo is now termed a fetus. The diagram to the left shows the connection point between the maternal endometrial lining, the chorionic villi, and the umbilical cord. The second trimester occurs from 14 to 26 weeks. This is also known as a fetal growth period, where the fetus will grow from 5 centimeters to over 30 centimeters in length. During this time, the external sex organs will appear, the outer ear structures, as well as the fingernails. HCG levels, or human chorionic gonadotropin hormone, will decline. In addition, the corpus luteum will disintegrate. This is because the placenta takes over the production of progesterone in order to maintain the pregnancy. Thus, HCG and the corpus luteum are no longer needed. During the second trimester, fetal movements may be detected as the skeletal muscles develop. During the third trimester, there is also an extensive amount of fetal growth. The fetus will typically grow from 30 to 50 centimeters in length. In general, as the third trimester nears its end, the fetal activity will tend to decrease. This is because the space within the uterus becomes limited. In addition, the mother's internal organs will become displaced in order to make room for a developing fetus. Childbirth begins with the onset of labor. Labor occurs when strong uterine contractions act to push the fetus and placenta out of the body. Labor involves a positive feedback, as oxytocin is released from the fetus as well as from the mother's pituitary gland. Estradiol is also an important hormone as it activates oxytocin receptors on the uterus so that they can respond to the increasing levels of oxytocin. This also causes the placenta to make prostaglandins that will stimulate even stronger contractions. This positive feedback loop is important in pushing the fetus out of the body. There are 3 stages of labor: dilation, expulsion of the fetus, and expulsion of the placenta. Dilation occurs as the cervix dilates to prepare for the exit of the fetus out of the birth canal. During dilation, the mucus plug that used to protect the developing embryo is shed as the cervix thins and widens to prepare for delivery. The expulsion of the fetus occurs when strong and continuous contractions force the fetus out of the body, typically through the vaginal opening. The expulsion of the placenta will then follow as the placenta detaches from the uterus and is also ejected from the body. After birth, suckling and a drop in estradiol will act on the hypothalamus and cause it to release prolactin. Prolactin is important in stimulating milk production in the mammary glands. Further suckling also will cause a positive feedback loop and stimulates the release of oxytocin from the posterior pituitary. This will cause the release of any stored milk. Oxytocin production can also be stimulated by infant crying. The presence of oxytocin after birth helps to reduce postpartum bleeding and also contributes to maternal behaviors to enhance the parent-offspring bond. Finally, we will discuss different modes of contraception. Contraception refers to any method that can be used to prevent pregnancy. They can act in many ways by preventing the production of gametes, by physically restricting contact between the gametes, or by preventing implantation. Also note that this information is for informational purposes only. If you want further information or are making life decisions, you should consult with a healthcare provider. Abstinence is considered to be a form of contraception where sexual intercourse is avoided either completely or during the period where conception is most likely, i.e., before or after ovulation. However, some complications can arise with this methodology. An egg, for instance, can survive in the oviduct for 1 to 2 days, where fertilization needs to occur. In addition to this, sperm can survive in the female reproductive tract for up to 5 days. As a result, intercourse should be avoided many days prior to and after ovulation. Also note that the timing of ovulation may vary between and also within females, making this methodology complicated to employ successfully. Coitus interruptus refers to the removal of the penis from the vagina prior to ejaculation. However, with respect to this methodology, sperm may be present on the penis from prior ejaculations, and also pre-ejaculatory fluid may contain active sperm. Also, this methodology involves precise timing and extreme willpower. Condoms in general provide a physical barrier to prevent contact of the egg and sperm. Male condoms cover the penis while female condoms will line the vaginal walls. Condoms also aid in the production of some, but not all, STIs or sexually transmitted infections. The diaphragm is also a method of contraception where this diaphragm structure is placed in the vagina, also acting as a physical barrier to prevent the sperm from reaching the cervix. Both of these methods are commonly used in conjunction with spermicides. Spermicides are also a mode of contraception that act to kill the sperm on contact. IUDs, or intrauterine devices, consists of metal or hormone-releasing devices that are placed within the uterus to prevent fertilization and also to prevent implantation. Birth control pills are also hormonal. However, these can be taken by either through ingestion or injection. Birth control pills work by suppressing ovulation and preventing implantation. Many birth control pills contain synthetic estrogens and progestin. This will stop the release of gonadotropin-releasing hormone from the hypothalamus, thus acting to prevent FSH and LH release from the anterior pituitary. As a result, the follicles will not be stimulated to mature and ovulation is prevented. Many birth control pills contain progestin only to thicken the cervical mucus. This will help to block sperm entry and also to decrease ovulation and interfere with the lining of the endometrium in order to prevent implantation. Note that there are many side effects, both positive and negative, that can result from hormonal-based methods. These methods are currently only available for female contraception at this time. Sterilization involves the permanent prevention of gamete production or gamete release. It can be performed on males or females. In females, it is termed tubal ligation and involves sealing or ligating the oviduct to prevent the egg from entering into the uterus. In males, it is termed a vasectomy and typically involves the incision and sealing or ligation of both vas deferens ducts in order to prevent the entry of sperm into the urethra. Abortion refers to the termination of a pregnancy in progress. Abortion may be spontaneous, as in the case of a miscarriage, or it may be surgically or hormonally induced. RU46, also known as mifepristone, can block progesterone receptors on the uterus. This will then prevent the uterine lining from being maintained. This drug can be taken to terminate a pregnancy within the first 7 weeks. There have been many recent advances that have made it possible to address and overcome many reproductive issues. Infertility refers to the inability to conceive offspring. This can be due to physical abnormalities or genetic abnormalities. In certain instances, genetic abnormalities may be correlated to the length of time of the oocyte that it has spent in meiosis. As females age, this length of time increases. This can usually lead to a higher rate of miscarriage or genetic abnormalities. STIs such as chlamydia and gonorrhea can also cause infertility if left untreated. There are many methods that exist to overcome infertility. These include hormone therapy that can be used to increase egg and sperm production, surgical intervention that can be used to remove any blockages or to correct any deformities that are present within the ducts of males and females, or in vitro fertilization. This involves the process where the oocyte and sperm are joined in a laboratory and then transferred to the uterus for implantation. In addition, there have been many advances that can lead to the detection of developmental issues and genetic disorders during the pregnancy stage. This involves both invasive and non-invasive techniques. Invasive techniques include amniocentesis and chorionic villus sampling. In amniocentesis, a needle is inserted into the amniotic sac and fluid is sampled for fetal cells. These fetal cells will then be run for genetic analysis. In CVS, or chorionic villus sampling, the needle is inserted rather into the chorionic villus. Remember, the chorionic villus occurs where the maternal tissue and fetal tissue join within the placenta. When the needle is inserted into the chorionic villus, it will then collect fetal cells that are used for genetic testing. Non-invasive techniques include the ultrasound and NIPT. An ultrasound can be used periodically throughout pregnancy to analyze fetal growth and development. Non-invasive prenatal testing, or NIPT, will collect fetal cell fragments that are circulating within the mother's blood for testing. Then PCR will be used to sequence and detect, amplify, and analyze the fetal DNA fragments from the mother's blood. All of these techniques can provide valuable insight into the development of the offspring.